Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the website qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary, for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the diseases of the foot, types and treatment. The infections of the foot are common in the areas where the people walk barefoot. In all the infections, lymphatics play a major role. It is the place the people neglect more unless it is giving severe pain. They include infected blister, paronychia, infected adventitious bursa beneath a corn, terminal pulp space infection, infected bursa over the hallux valgus, infected web space, infection of plantar interdigital subcutaneous space, infection of heel space, deep plantar abscess, infection of dorsum of foot, leprosy, Madura foot, ingrowing of nail, onychogryphosis, infected blister. It is the most common infection when the body temperature is normal and the blister is doubtfully purulent. It can be aspirated if the content is opaque. Penicillin can be given and aspirate sent for bacteriological examination. If it is frankly purulent, it can be incised. Paronychia. It usually occurs as an ingrowth of the toenail. An abrasion of the eponychium with contaminated scissors is another cause. The infection starts from the eponychium and the suppuration follows. The pus tends to frag around the cutaneous margin and may enter the area below the nail. Untreated may rupture spontaneously, otherwise drainage may be done under antibiotic cover. If ingrowing nail is present, treatment. The overhanging nail fold is pushed away and reduced in size by daily packing of the lateral groove with a wisp of gauze soaked in mild antiseptic. The central plate of the nail is thinned by filling. If more painful, surgery is performed. Infected adventitious bursa beneath a corn. It is usually due to improper chiropody. There are signs of inflammation around the corn. There is excruciation pain with even slight pressure over it. Draining is accomplished by paring the corn with a sterile scalpel until pus extrudes. Infected bursa over a hallux valgus. The deformity consists of outward displacement of the big toe. It tends to be progressive due to pull of the extensor longus, hallucis tendon. Further increases the deformity a bowstring mechanism. Infections. Bunia, inflamed adventitious bursa developing over the prominent head of the first metatarsal bone as a result of pressure. Sometimes suppuration follows and a big toe joint is secondarily affected. osteoarthritis of the big toe joint due to the pressure, malalignment of bones, severe pain develops, X-ray shows osteophytic outgrowths. Infection of the web space, there is the edema of the back, but diagnosis is made from the maximum tenderness. The extension from the plantar to the dorsal aspect of the web occurs earlier. Treatment in diabetics, orthodox drainage is disappointing. Disarticulation of the relative toe, leaving the flaps unsutured, is recommended. Infection of the plantar interdigital subcutaneous space. The infection of one of the spaces, the space between the digital space, is very common among coolies who work barefooted. A history of penetrating injury is there. Pain is very severe, but the constitutional symptoms are moderate. Exquisite tenderness located over the infected space confirms the diagnosis. Treatment. Draining incision is away from the weight-bearing area, after which a hemostat is directed into the cavity filled with pus and its jaws are opened. If the dorsal subcutaneous space is involved, a counter incision should be made. Infection of the heel space. The infection may be intradermal or collar stud extension from the deeper plane. Some cases are due to the infection of the fat pad of the heel situated in the subcutaneous portion of the posterior part of the sole. The portal of entry is cracked of the foot or pricky by thorn, etc. Pain steadily increases so as to interfere with the sleep. Swelling of the soft tissue that covers one or both sides of the calcaneus is present. In severe cases, the edema of the ankle becomes manifest. Tenderness over the space leaves no doubt as to diagnosis. Treatment. An incision is made on the medial or lateral side of the heel, fibrous septa within the abscess of the fat pad need division with a scalpel. The lips of the incision is trimmed to prevent the premature closure. Deep plantar abscess. The central plantar space situated deep to the plantar fascia is arranged in 4 stories of an apartment, each of which is occupied by the muscles that constitute the flexors of the toes. Infection of the various floors becomes increasingly less common as proceeds from the ground floor. Treatment. For drainage of the central plantar space of an incision parallel to the just above the medial border of the foot in the neighborhood of the instep is made. Infection of dorsum of the foot. The dorsal subcutaneous space usually is infected by extension from the subcutaneous interdigital space or web space. Treatment. To drain the space, incision is made distal to the dorsal venous arch but in the line of the digital vessels and nerves. The dorsum and subaponeurotic space is infected either from the direct puncture or from involvement of extension from the deep plantar space. To drain the space, it is best to confirm the presence of pus by attempting aspiration, and if diagnostic aspiration is positive, to make a longitudinal incision alongside of the needle. Leprosy. It is not infrequent. Initial manifestation may simulate a chronically infected colon. Madura foot. Myositis pedis. It is a chronic granulomatous disease in tropical countries. Most cases are caused by a filamentous organism, Nocardia madura, abounding in road dust, usually infected by a prick. Symptoms: firm, painless, rather pale nodule followed by rest of the nodule. The nodule becomes vesicles which burst to form the discharging sinuses. The watery discharge contains granules which are yellow, red, black in color. In black Madura foot, spread is mainly in the subcutaneous plane. In yellow and red varieties, the infection burrows deeply in and bone necrosis ensues. Gross swelling of the root with flattening or convexity of the instep is characteristic. Sooner or later, secondary infection supervenes with rapid deterioration of the local condition. Treatment: a wide spectrum antibiotic to deal with secondary infection and a prolonged course of dapsone 100 mg BD improves many patients and may obviate or postpone the necessity for amputation. Ingrowing toenail, embedded toenail, usually results from ensuing sweaty foot in tight shoes as encouraged by cutting nail short and convexity. The side of the nail curls inwards and grows to form a lateral spike, which causes painful infection of the overchanging nail fold. Treatment: conservation measures are successful, but with tedious manipulation with antiseptic and trimming the nail. Surgery: the nail is like a letter protruding from a shallow envelope. The envelope is the germinal matrix which must be removed or affected side or hole of the nail. A tourniquet is necessary so that the germinal envelope may be seen and dissected out. Onychogryphosis. It is a thickened and crooked overgrowth of the toenail, usually the big toe. Causes may be trauma and fungus infection. Usually occur in elderly and children and look like a ram's horn. Treatment: a jiggly saw can cut through the base and the remainder can be controlled by peeling. If necessary, the bed and the nail can be removed as a whole. That's all about the diseases of the foot, and in the next video I will discuss about some other disease. Thank you.